Good morning for AM 1340 and 99.5 FM WGRV. I'm Reid Seals, and I'm here for our monthly interview with Greene County Mayor Kevin Morrison. Good morning, Kevin.
Good morning, Reid.
First up, can you explain the reasoning behind the county employee pay increase that was approved on Monday in light of the coming salary study that the county approved a while back?
Yes, the county commission commissioned a salary study, approximately $17,000, to look at the pay and salaries, compensation, if you will, of all the positions in all the departments across the county. That document is 99% complete, 95% complete or so. There's a few positions that need to continue to be fine-tuned, and our salary consultant knows that. The rationale for advocating for a pay increase before the rollout of that thing is that the universality of the pay scale shows that all of the employees across all departments in all positions are woefully underpaid compared to their counterparts. So we can't really make a mistake or go wrong by giving sort of an across-the-board pay increase. That being said, the salary scale wasn't ready for rollout, and we had deferred any type of pay increase at the beginning of the budget year in lieu of the information in the salary scale. So we didn't think that, for instance, that it was very fair for the employees to have to wait and suffer given what kind of year 2020 has been and given what kind of disparities exist for pay. So our revenues to support this without a tax increase or without tripping a tax increase in the future are very solid. So we have very solid financials, which was another concern actually at the beginning of the budget year. We were sort of in the middle, we thought, of the coronavirus impact. We didn't know how that would be impacting financials and government revenue and our financial footing. But it's turned out that we're in a very good, solid financial position, and we've done great things with regard to tools and facilities and repairing stuff that needed to be repaired, replacing vehicles, cutting down on maintenance costs, and doing other things that saves a lot of money. But it was time to do something for employee compensation. So the idea was sort of hatched, sort of serendipitously, if you will. And, you know, once that sort of cat gets out of the bag, it's sort of hard to stop that. So a few of the commissioners that knew about it had approached us about doing a resolution to see what the full county commission would think of it. So they voted Monday evening and awarded the pay increase, and I certainly support that for our employees because we've got a lot of people doing a lot of great things, and they're doing it for a very meager compensation. And I'm thinking about people at our convenience centers, our custodial staff, even people that have been with us nearly a career can certainly benefit from the pay increase, and our employees can be given a little appreciation, and the people that pay the bills can rest assured that this isn't going to trip a tax increase or cause a tax increase.
Do you know what plans are for the old election office now that it's been purchased?
Well, at our last county commission meeting in November, Reid, the county commission voted to move to a public auction after rejecting the offer of Walter State. The public auction essentially netted about $25,000 to $30,000 more than what their offer was. The winning bid, if you will, was $125,000 by Mr. Kent Bewley, and I do not know what Mr. Bewley's plans for the building are. He's a fine businessman and makes very savvy investments, so he may have some type of future office there, some type of business that's going to locate there. may renovate the building and then lease it to someone else. I don't know what his specific plans are, but if it's any in any relation to the other investments that Bewley Properties have made, it's turned out well. And I think of the car museum and the Crescent School and those types of things. So I expect it's in good hands.
What are your plans in regards to the mask mandate as it is set to expire next week?
Well, the governor's order just came out just recently, and I had a conference call with the governor yesterday where he did encourage that municipalities that had mask mandates in place to continue to extend those mask mandates, to continue to further educate the public and encourage them to do the small things that we can do to get our hands around this virus. So in that, and I haven't consulted, for instance, with our Northeast Tennessee counterparts, but for the most part, we're all in favor of extending that mandate in the time given to us by the governor. Again, I know that it's a pain in the tail for some. It's somewhat frustrating in that we've never had to wear a mask over here for whatever reason. Being overseas and in Asian countries and whatnot, that was a fairly routine thing. But that's wearing a mask is one of the few meager compromises, I guess, if you will, or sacrifices that we can at least try or attempt to gain control of this. And we have so many people, for instance, that are asymptomatic, and I've been in on a few of those. Sometimes I've wondered, for instance, myself, if I'm asymptomatic. I've not been sick yet, but I've been in quarantine a couple of times. Haven't been tested, but the wearing a mask is a courtesy, for the person that you happen to be with, and it's a small token of sacrifice that we can make to try to get control of this. I know our healthcare system, our Ballard system, our system to the south, Covenant down in Hamlin County, essentially every single healthcare system across the state, and the state has warned us multiple times that the system is very close to collapse due to the influx and surge of the cases of COVID, along with having to be able to be prepared to treat other emergencies and sicknesses. I've certainly had family members and friends just in the last few days that have gone to urgent cares and they've gone to ERs. And of course, naturally, I get calls about, can't we do better than this, or what can you do, Mayor, to facilitate us getting a hospital bed? And the answer to that is crushingly, there's not a whole lot we can do. Staffing is such, the influx of patients is such that it's growing to a critical level, and everyone needs to be aware of that. And I don't mean to sit here and say these things that the sky is falling type thing, but we do need to take the measures that we do know that help. Mask, I think, help to a small degree. Certainly staying apart, social distancing where you can, certainly helps probably the most. And then only doing that business which doesn't put you in confined spaces with people outside of your household is probably very important. And but we will probably be extending the mask mandate for at least the time period the governor has granted as an additional measure to try to gain control of this, Reid. And we certainly would plead with everybody. The governor gave a very impassioned plea for people to be a little bit more neighborly conscious, if you will, and wear a mask and try to do those things that would keep the state's healthcare system functioning so that we could treat people.
So why was Nolachuckey chosen for the playground grant?
Well, Nolachuckey was chosen, Reid, well over a year ago for a walking track. It's part of the Healthy Built Up Environment Grant that the county applies for, and we've received numerous times. Since coming to office, I've been all about this grant money and trying to get as much of our tax dollars returned to us so that we can use it here for different things. And this is one of these. This comes through the health department. But Nolachuckey was chosen as it's a community, out in the county, and these grants are sort of earmarked, or at least identified, to try to go into more rural areas or sparsely populated areas to encourage people for fitness, walking, exercise, and the like, and adding these facilities or upgrading these facilities in some cases is utilized to try to encourage that. So, for instance, Bayleton has a walking track. North Greene Middle was the recipient of the grant a few years ago and has a walking track. McDonald, I think, was chosen last year or the year before. With COVID, we're sort of a year off. And then we were essentially moving on around the county from McDonald down to Nolachuckey to, again, bring this facility to fruition there at the school so that the people in the Nolachuckey community would be encouraged to go up and walk on the track, and it promotes community cohesion, fitness, and the like, and so that's the reason they were chosen.
And I know you're excited about this one. Can you give an update on the new EMS substation?
We've got a lot of great things going on, Reid, with different projects to either save the taxpayers' money, add to our capabilities. I'm very proud of the EMS building that's taking place. I certainly want to, our contractor that won the bid, CNC Millwright, has done an exceptional job in building that facility up there. It's 5,000 square feet. We started just before the early voting period for the presidential election on October the 10th. And as of Tuesday, this coming Tuesday, the facility will be 100% complete. All of the testing will be done, and a certificate of occupancy should be issued by the various agencies to put that building into use and operation. It's approximately 5,000 square feet. It has 3 ambulance bays. It has crew quarters enough for 3 ambulance teams, 3 24-hour ambulance teams, and it is very strategically located right in the center, essentially of the heaviest traveled area of town. So it will serve the residents of Greeneville very, very well in terms of lowering response times for an ambulance to come or respond to an emergency, particularly to vehicle accidents and things like that on 11E in the center of town. And it's strategically located very close to the hospital that we have, so it could be very responsive to Community Hospital East, the old Laughlin campus. And but on Tuesday, we expect that all the inspections will be done. Right now, as the building stands, it's about 99% complete. They're putting basically the polish and fine touches on drywall and cove base around the floor, touching up the paint, excuse me, testing the HVAC systems. It's just a standard sort of shade and shelter, but it is very much a very functional building. It's well designed. Dave Wright aptly points out it probably isn't going to win any architectural awards, but it will serve Greeneville and Greene County very, very well long after I'm gone. So a great facility. So it paid for with CARES Act money. We don't have really a cent of our tax dollars in it other than some of the money that we send to the federal government. But we have chosen here locally to invest in things like this rather than, plexiglass and plastic sheeting and those things that are certainly temporary. We have used our money, I feel, very wisely to get the facilities and the services upgraded that's going to serve our citizens well into the future after COVID is gone.
Well, Kevin, I want to wish you a Merry Christmas and thank you for joining us today.
Reid, thank you very much. I would like to wish all the citizens a very healthy and happy and Merry Christmas, and just continue to do those things that protects you and your family, and I hope they stay safe and well. And I certainly pray that 2021 turns out to be a heck of a lot more merry than 2020.
This is Reid Seals for AM 1340 and 99.5 FM WGRV.